On the cutting edge of medicine, and now a revolutionary spine surgery is helping to cut down time in the operating room, and it's making for a faster recovery as well. As health reporter Haley Hernandez explains, this procedure doesn't do the things that makes traditional spine surgery so miserable.
Just shy of 70, Russell DeBarberos averages 100 miles on his bicycle.
I can ride from here to Beaumont with no hands.
Until he noticed he was losing power and getting tired faster.
Because my left leg was stronger, so when I pushed down, the bike would lurch to the left every pedal stroke. And, you know, I'd be like leaning, saying, what is wrong with me?
He found out it was a problem with a disc in his back. Instead of a traditional invasive operation, surgeons Andrew Roser and David Wimberly at Texas Orthopedic Hospital surgically fixed Barberos' spine in a new way, reducing pain and time.
These procedures, used to take several hours, sometimes up to 4 hours to do, and this procedure this morning took about 1 hour and 15 minutes to do the same thing.
Most people that have the surgery because they have a pinched nerve and have severe pain that radiates into one or both of their legs. And the blessing with a surgery like this is folks wake up and their leg pain is usually gone about 85% of the time.
Here inside the operating room, you can see how the surgery is performed. A patient is on the table face down and the doctor sits facing the side. This is near the patient's hip. The position allows gravity to maintain the natural curvature of the spine. They don't need to navigate through many muscles and tissue. It's a lot less invasive than previous methods. The incision is small and
then we can slide in a piece of 3D printed metal titanium that goes in there and helps lift one bone up off typically would be a collapsed disc, help relieve pressure off the nerve, and help that whole area fuse much more quickly.
The titanium is porous, so bone will grow into it and fuse together, as opposed to traditional plastic pieces where bone could not grow.
In the United States, there are hundreds of thousands of spine fusions that happen every single year. This is frequently a situation where their spine has become unstable, and that can cause tremendous irritation to the nerves and result in tremendous pain for that person.
But for Russell, he won't have to worry about that. He was back on the bike just weeks post-surgery.
You don't have to live in pain. I'll be 70 next year. What am I waiting for? I want a quality of life. I want to maintain the lifestyle I have now.
It's called the PTP procedure, and the doctors say patients go home the same day or next day after the surgery. It's been a game changer for patients with degenerative disease or chronic pain, not just spine injuries. I'm health reporter Haley Hernandez, KPRC 2 News.